Good morning. I'm Luz Rivas. I'm proud to represent the East San Fernando Valley in the California State Assembly. Thank you all for joining me today. Thank you to the healthcare advocates for being here to celebrate the $2 million state investment that will be going to the San Fernando Community Health Center for their Corazón del Valle project. Today is a very good day, but first and foremost, affordable health care is not just a privilege. It is a fundamental right that every individual should have access to. The availability of quality health care services plays a crucial role in promoting the overall being of our community. Low-income communities, often confronted with economic challenges, face a unique set of obstacles in accessing quality health care services. This is why I was proud to advocate for the San Fernando Community Health Center for the Corazón del Valle project, because I know that this funding will address health disparities and ensure that individuals can receive timely medical attention when health concerns arise. This investment will be utilized in a number of ways to perform high-quality comprehensive health services and wraparound services such as case management, enrollment, and transportation. These services are much needed by members of our community. In an effort to serve the most vulnerable members of our communities, this health center will be located beneath a complex of 180 units of supportive housing designed for low-income families, adults, and seniors. At its core, this center will provide affordable health care and remove barriers that prevent individuals and families from seeking and receiving the care they need to lead healthy lives. Now, I would like to welcome Audrey Simons, Chief Executive Officer of the San Fernando Community Health Center. Welcome. Thank you so much.
Again, I would like to thank the Assemblywoman Rivas. I am honored to represent San Fernando Community Health Center as we expand access to quality, compassionate health care in the heart of Panorama City, a community with which we share deep roots. As a federally qualified health center, San Fernando Community Health Center is committed to providing care that is high quality and accessible to the community, especially the vulnerable and the underserved. I would like to express my deep appreciation to Assemblymember Rivas and her team for championing this project and working to secure funding to bring needed healthcare services as an integral part of this beautiful project. The impact of the integration of health services into such a beautiful addition to Panorama City will be an asset available to the entire community. Assemblywoman Rivas's leadership has paved the way for families to access the whole person care they deserve within the community they call home. To the Holos Communities team, we honor your commitment to building equitable and safe communities where everyone's essential needs are met. San Fernando Community Health Center is delighted to have been invited to provide health care within the footprint of the beautiful Corazón del Valle project. By coupling housing and health care services, Corazón del Valle will enable individuals and families to enjoy fuller, healthier lives. A healthier community is a sustainable community. When we empower people to take charge of their own health, it improves the well-being of the entire community. Our new satellite clinic, located within the Corazón del Valle housing development, now will make it possible for our healthcare providers to provide care where people live, work, and play. When this satellite health center opens in the summer of 2024, Community members will have access to a full range of medical, dental, and behavioral health care services. We will continue to deliver patient-focused care to every person, regardless of income, insurance status, or ability to pay. Finally, this amazing announcement would not be complete without recognizing the vital contributions of our community and industry partners. This project is a direct result of individuals asking the questions, what does our community need, and how can we work together to make it happen? In fact, Louise Oliver of Goodwill Southern California, who also serves on our board, first told me the great news that a nonprofit organization had been allowed to acquire the land to build affordable housing for the community. And Sonia Blake, President and CEO of the Valley Economic Alliance, first introduced me to the Holos community team, including Audrey Peterson and Christian Arbimuda. I always his name is difficult for me. He is the executive director of Holos Community, and he is the guiding force in how they develop their communities. This was the start of a wonderful collaboration. I would also like to acknowledge the amazing design and architectural talents of Perkins and Will, the firm who designed this beautiful complex. When their firm knew a federally qualified health center had been invited to occupy the commercial space within Corazon del Valle, they offered their amazing design and architectural services pro bono. Several of their team is here today, and we appreciate all of your hard work. And there are many other leaders in this community who understand and support this new model of housing, a model that assists the unhoused, increases health equity, improves sustainability, and strengthening of communities. Corazon del Valle shows that when communities work together, we can turn possibilities into realities and make meaningful change. On behalf of our entire San Fernando Community Health Center team, thank you for allowing us to continue serving the community we love. Thank you again, Assemblymember.
Thank you for your leadership, Audrey. This is why we're here today, to celebrate. Next up, I would like to welcome Jeff Chawinson, Chief Financial Officer of the San Fernando Community Health Center.
Thank you, Assemblywoman Rivas. San Fernando Community Health Center has a history that goes back almost 100 years. In fact, it's just a few months short of that. It started as San Fernando Community Hospital, and it expanded its reach into Panorama City with Panorama City Hospital. Panorama City Hospital later on became Mission Community Hospital. On the sale of Mission Community Hospital, San Fernando Community Hospital became a community health center. And that was in 2013. And in 2015, San Fernando Community Health Center became a designated federally qualified health center. We look forward to again becoming part of the Panorama City community when our doors open here at this beautiful and much needed supportive housing. I don't want to call it a health project, health development. I think that's a better word. We look forward to welcoming all through our doors to satisfy their needs for comprehensive health care, as was so eloquently listed by Assemblywoman Rivas. Again, thank you all for everything you've done.
Thank you. Okay. Thank you, Jeff. Next, I would like to welcome Erin Dewan Morris, Vice Chair of the San Fernando Community Health Center Board of Directors.
Thank you. Hello, everyone. My name is Aaron Morris. I serve as the Vice Chair of the San Fernando Community Health Center. We are very excited for this wonderful grant. Our board is made up of a very diverse group of individuals that live and work in the community, and so we're very excited that this grant will help eliminate the barrier of financial barriers and transportation barriers that exist in this community. This grant will help provide high-quality medical and dental services, behavioral health, and quality care for the community. And on behalf of the Board of Directors, the City of San Fernando, Panorama City, and our community, we'd like to thank you, Luz Rivas.
Thank you.
Thank you.
For being here. Thank you. Thank you, Aaron. You know, San Fernando Community Health Center is a federally qualified health center serving the entire San Fernando Valley and providing high-quality care with compassion at an affordable price to everyone in our community. I know that this funding will support them in their goal of providing affordable health care to promote health equity. Isn't this amazing? Accessible and affordable health care right downstairs of where families that need it most will live. I am so excited today to deliver this investment from the state of California as the state representative from this community. This is why I go to Sacramento every week, all right, to advocate for our community. So it's always a good day for me when I get to deliver for the community. I want to thank all of the staff and administrators from SFCHC for working with my team to support this budget victory and for being a strong pillar in our community. Now I would like to formally present this $2 million check to deliver the state funding, which will, of course, improve the health outcomes of our community. I'd like to invite Audrey, Jeff, and Aaron to join me to deliver this check. Maybe someone over here. Yeah, wherever. Is that in the way? Are we? Yeah, because we're like. Are there representatives from other offices? Yes. Can you bring them up? Yes. Yeah. I know. I've invited the councilwoman, but they have council today. Yeah. So please join me. Come on, in the picture. Yeah. Get it. Yes. Get it. Hard. Got it? Thank you so much. I'm so excited. I can't wait to see it. Yes. Next, we'll be here for the ribbon cutting, right?
Yes.
Well, you said summer 2024?
Yes.
Okay.
Phase one, let's see, where's the gentleman?
Let me just check. Okay. I'm already excited getting the details from the team, but if there are any questions from anyone here, we'd be happy to answer questions. I was asking when the next time we'll be here will be for the ribbon cutting, I believe summer 2024. Any questions from anyone? Okay, seeing none, thank you for joining us today. And next time, we're all going to be here to actually see the final center open. Thank you. Oh, you do have a question. Oh, I'm sorry, I didn't realize.
I'm so sorry. No, this information might also already be available, but I was just wondering, you said probably next summer, 2024?
Audrey, phase one will be available when? Yeah.
So, does anyone want to answer up here? I just, we just want to make sure that the details, because we're so excited, right? So we want to know when to come back.
Well, we're very much looking forward to everyone coming back. Audrey's team will be housed in phase 2, which is still the scaffolding over to our right here. That will be complete in Q1 of 2023, and so then Audrey needs some time to build out the space, and so summer 2024 seems right about right.
And that would be open at that time for the initial residents. Do we know how many individuals or families that would be?
Yeah, it'll be open to the residents of the development as well as the larger community. I don't know if you have numbers to who you think you'll serve, but the apartments itself is 180 one-bedrooms all the way up to 3-bedrooms, so it could be a large range of number of units of actual residents, and then the larger community will bring in even more.
Okay, and do we already know, like, are they all slated for occupancy already? Like, do we know who they're going to be open to, or is that still in process?
It's still in process, so we start our lease up about 6 months, so phase 1 will actually start that process pretty soon. Half of those residents will be leased up through the coordinated entry system. The other half is a lottery system through the general public. Yep. Yeah, no worries.
Thanks, Audrey. Before I conclude, any other questions, just making sure. Okay. Thank you. Thank you for being here today. And like I said, next time we'll be here for the grand opening of the Community Health Center. Thank you.
Thank you so much. I'm so excited. Aren't you glad we didn't organize this for Monday or next Monday?
Oh, I know the hurricane. They're hotter.
I thought about it.
We just don't get a break, right?
Yeah, that's one thing right now.